Hi everyone, welcome back to part 2 of our talk on ICD-10-CM Coding, Infectious and Parasitic Diseases, Coding Chapter 1 for A00 through B99. This is part 2 where we're going to look at some of our specific types of infections when looking at respiratory infections as well as the rest of the body area and symptoms. If you haven't already watched part 1 of this 2-part video, make sure to check that out because we talk about some specific guidelines when looking at excludes 1 and 2 notes, how to look up and look at infections for bugs and how they define, as well as some of the specifics for sepsis, some of the specifics for HIV infections, and others identified in your guidelines. There is a separate video, not part of the part 1 or part 2 series, where I talk about coding for COVID-19 infections. And if you're interested in that, I'll make sure to put a link in the comments. So let's get started. Right now I want to look at what we look at when we're looking up a specific code. So I've left on the board from our previous video some of the references I want you to look. First, always keep in mind that if a patient is resistant to a microbial drug, we want to list the code Z16 as a secondary or tertiary code based off of the type of resistance that their bug is resistant to. So a lot of times you'll have bugs that are resistant to antibiotics because they're not responding. When that's coded, if you want to look up the type of drug they're taking, maybe the provider has specified the type of drug, like resistant to amoxicillin, and you're going, what kind of drug is that? If you're not familiar, you can look at the physician's desk reference, which tells you all the information you need to know about drugs and how to code them. If they're a carrier for an infection, you also want to make sure that you're listing the carrier code and not one of the codes from the current infection codes. But right now we're looking at infections. And so you want to always keep in mind the term infection as your main term. Sometimes you'll see something such as a URI or a UTI listed, and you may not think of the term infection, but let's talk about what it is when a patient has a URI. This stands for upper respiratory infection. And your main term being the problem is the infection. So always start with your terms by looking at, can I say upper by itself and make sense of it as a problem? No, I cannot. That's a location. Can I say respiratory by itself and know that that's a problem? No, I cannot. That's talking about a location as well. So when we break down the term and we say what is the problem, we start first by saying infection. Same thing when a patient has influenza. They may have influenza, but what is the problem? The upper respiratory infection may be caused by influenza, or it may be something else. Let's say that we have a patient with a Staphylococcus upper respiratory infection. So upper respiratory infection due to Staphylococcus. Okay, we're first going to look at the term in our alphabetical for infection. And this carries over several pages. I am, just to remind you, if you haven't seen the first video, I'm in ICD-10-CM 2020 edition from AHIMA for my code book, and I'll list the page numbers as we go along. If you're in a different year or a different edition while watching this video, make sure to look at those differences and see any differences in page numbers as well as new codes that may have come out or changes to the code guidelines. As I look up infection, I'm going to look first for infection, which will start on page 186 of my coding guidebook, alphabetical section. And I'm going to go alphabetically looking for the location of the infection. Now, upper doesn't tell me anything. So when I say where is the location, the first thing I want to say is upper body, upper where? Respiratory specifies the body system, and that should be my secondary term. So I'm going to look first for infection and then respiratory, which I will then find on page 189 in the second column about midway down. When I get to upper respiratory, I notice that the word tract is in parentheses. Even though that's not part of the term I'm looking for, the parentheses are only meant to help me by giving me additional terms I may have seen. And it's important that if I see those, I don't need to look elsewhere because it has that word there. I want to understand what that word means and how it applies. I also see the term NEC for not elsewhere classified, meaning that if this particular diagnosis had a different name, like pneumonia, which is could be part of the upper respiratory infection, you still want to look for the term directly if it's classified elsewhere. So now I want to look for the rest of my terms. So I have upper respiratory infection and is due to streptococcal. I see here the first option is acute, then chronic, influenzal, lower, rhinovirus, syncytial virus or RSV, upper, and upper is where I want to be. So my next term, now that I've gone to infection, respiratory, and I found upper. And pay attention to what it has next to it. You have the term acute, so you may have had an acute upper respiratory infection, and that's all they stated. This would be exactly what you would need if it was acute, but we have more information. Once we look here, we have a breakdown of chronic, streptococcal. I think I was saying streptococcal and I wrote staph. Did I confuse you? Streptococcal and viral, and a couple of different types of viral. I'm going to stop with streptococcal, which is J06.9. Now remember, you never want to code out of the alphabetical. Even though this code doesn't have a dash next to it, which in some books indicates that it is a complete code, you still want to look at J06.9 in the alphabetical. Now I know you may be thinking, wait a second, I thought this video was on bugs for infections and diseases. And it is. So follow me as we go to J06.9 and look at a code in the respiratory system, even though we're coding in our infectious diseases. I'm going to find my J's. There they are. And it's a small chapter, not very large. Nope, I skipped it. There we go. So J06 is going to be found on page 707. Now when you're looking in your tabular, always keep in mind when you jump into a different chapter than what you're familiar with, look at the beginning of the chapter to find if there's any specific code first, code also, excludes notes that apply to the entire coding chapter. So even though I'm going to J06, I'm going to go first to the beginning of chapter 10 for diseases of the respiratory system. Okay, so I'm going to start with the chapter. I do see that there is a note that if the respiratory condition is described as occurring in more than one site, it is not specifically indexed. It should be classified to the lower anatomical site. So go to the lowest part of the respiratory system. That note applies to everything in here. That's good to know. Doesn't apply to us today. There's also a note here that says use additional code where applicable to identify exposure, history of tobacco, occupation, and various other tobacco uses. So anytime you have a patient come in that has a respiratory condition and they have any type of tobacco use or exposure, you want to make sure to pick up the proper code for that as well. And that can be picked up anywhere from the doctor's note or the nurse's note, even in your current problem, so long as it is verified by the provider or staff that it is still active. There's also an excludes to note that indicates to us that this would exclude or be in addition to. So remember, your excludes to note means not coded here, not part of this code. And you do in fact have certain infectious and parasitic diseases. That is an excludes to note, meaning we will code our A and B codes in addition to any code we have from the J section. There's also references for perinatal and pregnant patients, endocrines, injuries, poisonings, neoplasms, smoke issues, and signs and symptoms related to laboratory findings. So all of that's important to look at because we want to look at all of our chapter notes. And that tells us code tobacco, and excludes 2 for your A00 through B99, which simply means not included in J code. That's what that means, okay? So at that point, I can look at my block. J06 falls under the first block for J00 through J06 for acute upper respiratory infections. I want to look at that block and see if there's any exclude notes for the entire section. There is. So I go from the chapter to the block, which is at the beginning of J00. And there is an excludes 1 note that excludes COPD, or chronic obstructive pulmonary disease with acute lower respiratory infections. That does not apply to us, so even though there is an excludes 1 note, I can say that's nice and move on. So at that point, I'm ready to go to my category, which is J06. So even though we had this full code, we want to start 1, 2, 3 different sections before we go to J06.9 to see anything that may apply. At this point, category J06 is found on 707 for acute upper respiratory infections of multiple and unspecified sites. There is an excludes 1 note for acute respiratory infection not otherwise specified. So I would come back here and say, is it not otherwise specified? No, it is. It was streptococcus, not staphylococcus, not staph. And then there's also exclude 1 for influenza virus with other respiratory manifestations and streptococcal pharyngitis. Pay attention to your terms, and if you're not familiar with them, look them up. Remember, Google is your friend. Never marry her. Never take Google's word for something as fact, but you can absolutely use Google to look up terminology, use a medical dictionary. I like medical dictionaries myself, but whatever is the easiest for you. At this point, I can say, no, it's not pharyngitis because it's not an infection in the pharynx. It is of the upper respiratory, and it's not influenza, and it's not otherwise specified. So my excludes 1 is nice to know, does not apply. At that point, I'm looking at the breakdown between J06.0 and J06.9. In this case, we know that J06.9 was suggested from the alphabetical, and we can confirm acute upper respiratory infection, unspecified, and look at how the subcategory is. Because you may sit here and say, no, it's specified, it's due to strep. Remember, the term unspecified is talking about this current subcategory, which is the difference of where, by looking at the laryngopharyngitis versus upper respiratory that's not laryngopharyngitis. And so if we didn't specify the area and it's not specified elsewhere, then upper respiratory infection is not specified to the location. So J06.9 is correct. It gives some examples of upper respiratory disease acute and upper respiratory infection NOS. And then we have, at the end of all of that, use additional code. Okay, so we have use additional. B95 through B97 to identify the infectious agent if known, such as respiratory syncytial virus or RSV, and it gives the code B97.4. At this point, this is the easiest and best way to code for this. You're going to come to B95 through B97, which has saved you all of the effort of looking in the alphabetical for the strep, and you're going to have all of the codes you need this way. So I'm going to go now to the chapter we're learning today for infectious diseases and parasitic conditions. and I'm going to look at B95. Again, if you weren't familiar with the chapter, start first at the chapter and look at your chapter 1 notes, which we've already done. Then look at your block, so B95 through B97. B95 is the beginning of the block for bacterial and viral infectious agents. And I can see that on page 476 of my book, where it tells me what the block is. So our second, B95 through B97. That second step here, look at the block. I've already looked at the exclusion 1 and 2 notes earlier, but if I wasn't as familiar, if it's not fresh in my mind, I would look at those and say there's an excludes 1 for the certain localized infection, there's excludes 2 if they're a carrier, and other infections for J codes, which I've already coded with J06.9. So I can go to the block now of B95 through B97. The beginning of B95 is going to be found on the bottom of page 495 of my book, and there is a note that applies to the entire block, which says these categories are provided for use as supplementary or additional codes to identify the infectious agents in diseases classified elsewhere. The disease that's classified elsewhere is the upper respiratory infection, J06.9. That should be primary because this is additional. The term additional means it is secondary code. Okay? At that point, I can look at the different breakdown of the category. I have B95 for Streptococcus, Staphylococcus, and Enterococcus as the cause of diseases classified elsewhere. Now, in my head, I already know that's going to be the correct code, but always read up and down, so look at the other categories and make sure that's the correct one. B96 is other bacterial agents, and B97 is viral agents. So I know because I have the term as strep that B95 is the correct category. So I'm going to put B95. Here I continue looking and I see the difference of Streptococcus group A or group B, Enterococcus, Streptococcus pneumoniae, other Streptococcus as the cause elsewhere, and unspecified Streptococcus elsewhere. And then also Staphylococcus with breakdowns, other Staphylococcus, and unspecified Staphylococcus as a cause elsewhere. So at this point, I can identify that, yes, it is Streptococcus, so it's going to be either B95.0, .1, or .3. Hang on. B95.0 is Streptococcus group A. So I'm going to say, do I have group A? No, I do not. I don't specify a group, so I would not have group A or group B. Streptococcus pneumoniae, was B95.3, and this is not specified as Streptococcus pneumoniae. So at this point, I'm looking at the next page of other Streptococcus versus unspecified Streptococcus as the cause for the disease classified elsewhere. Did we specify the type of Streptococcus? If we did, and it's not one of the specifications listed, then I would choose other Streptococcus as the cause. But I did not specify the type of Streptococcus, so this would be an unspecified type, and I would in fact use B95.5. And I can notice there's no additional symbols telling me that there's additional characters required, so that is a completed code. That's all for our coding on our respiratory system. Take some time to look through it and see how some of these are coded. I highly recommend, as you're coding, when you're looking at diseases of infectious and parasitic conditions for Coding Chapter 1, A00 through B99, look first at the type of infection. Use the term infection to help you find it, or if you have a specific type of infection, use that first. Pay special attention to your use also or use first notes because they're going to help you in finding the code. And of course, always reference your guidelines as you go because they will give you information on areas that you may have missed. That's all for today. Until next time, have a great day and we'll see you soon. Make sure to follow our other videos or subscribe if you'd like to get notifications on more videos coming to you soon.